Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 5 NCLEX questions. Without delay, let's get started.
After a lengthy labor process, a primogravid client gives birth to a healthy newborn boy with a moderate amount of skull molding. Which of the following would the nurse include when explaining to the parents about this condition? 1. It is typically seen with breech births. 2. It usually lasts a day or two before resolving. 3. It is unusual when the brow is the presenting part. 4. Surgical intervention may be necessary to alleviate pressure. The correct answer is 2. Molding occurs with vaginal births and is commonly seen in newborns. This is especially true with primogravid clients experiencing a lengthy labor process. Parents need to be reassured that it is not permanent and that it typically lasts a day or two. An elderly woman experiences short-term memory problems and occasional disorientation a few weeks after her husband's death. She also is not sleeping, has urinary frequency and burning, and sees rats in the kitchen. The home care nurse calls a woman's primary health care provider to discuss the client's situation and background, assess, and give recommendations. The nurse concludes that the woman, 1. is experiencing the onset of Alzheimer's disease. 2. is having trouble adjusting to living alone without her husband. 3. is having delayed grieving related to her Alzheimer's disease. 4. is experiencing delirium and a urinary tract infection. The correct answer is 4. Delirium is commonly due to a medical condition such as a UTI in the elderly. Assessment of a primogravid client reveals cervical dilation at 8 centimeters and complete effacement. The client has severe back pain during this phase of labor. The nurse explains that the client's severe back pain is most likely caused by the fetal occiput being in a position that is identified as which of the following? 1. Breech. 2. Transverse. 3. Posterior. 4. Anterior. The correct answer is 3. When a client has severe back pain during labor, the fetus is most likely in an occipito-posterior position. This means that the fetal head presses against the client's sacrum. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The son of an elderly client who has cognitive impairments approaches a nurse and says, "I'm so upset. The primary healthcare provider says I have 4 days to decide on where my dad is going to live." The nurse responds to the son's concerns, gives him a list of types of living arrangements, and discusses the needs, abilities, and limitations of the client. The nurse should intervene further if the son makes which comment? 1. "Boy, I have a lot to think about before I see the social worker tomorrow." 2. "I think I can handle most of Dad's needs with the help of some home health care." 3. "I'm so afraid of making the wrong decision, but I can move him later if I need to. For I want the social worker to make this decision so Dad won't blame me." The correct answer is 4. Expecting the social worker to make the decision indicates that the son is avoiding participating in decisions about his father. Which of the following is essential when caring for a client who is experiencing delirium? 1. Controlling behavioral symptoms with low-dose psychotropics. 2. Identifying the underlying cause of condition or illness. 3. Manipulating the environment to increase orientation. 4. Decreasing or discontinuing all previously prescribed medications. The correct answer is 2. The most critical aspect when caring for the client with delirium is to institute measures to correct the underlying cause of condition or illness. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.